No. I mean 16 in a minute. We don't attach the state until it's till we're down less than that. Even if you're sound asleep, she'll be asleep in a second. Fast asleep, I mean. Respiration naturally decreases in sleep. All right, I'm going to attach the state because she's... you can hear me, but you won't wake up. You can hear me, but you won't wake up. I'll know that you're hearing me when this finger, which I'm going to touch, begins to rise. I'll know that you hear me, but you can't wake up. You hear me, but you can't wake up, and that finger will rise and tell me that you hear me. That finger will rise and tell me that you hear me, but you won't wake up. You're hearing me, but you won't wake up. You're hearing me, but you won't wake up. And that finger, can you see that finger come up? Can you all see that finger come up? Now, you hear me, but you won't wake up. Now, an odd thing is going to happen, however, after you do wake up. You're going to find that from your right shoulder on down to your fingertips, you will have no feeling whatsoever in that arm. From the right shoulder to the fingertips, you will have no feeling in that arm whatsoever. You won't even know. I don't want to give that as a suggestion. That anesthesia will be the best anesthesia you've ever known. All right, now I'm going to stop talking, and 3 seconds after I stop talking, you'll wake up, but you won't remember that I've been talking to you. Well, did you have a good sleep? Were you really asleep? Good. Tell me something. How's your left arm?
It's okay.
How's your right arm?
It's okay.
Got any feeling in it at all?
I don't know.
All right, well, let's find out if you have any feeling in it. Tell me whether you can feel anything that I'm doing to you. Feel anything? Nothing at all. It's pretty good anesthesia when you can look right in there, this clamp that's tight, and I don't feel anything. As it's on you. Try that if any of you doubt it. Now, you see this anesthesia in which you feel absolutely nothing, and that's what you've got. That's the anesthesia you have when you have hypnosis attached to sleep. And we could anesthetize you so that from the shoulders on down you would have absolutely no feeling any more than you have in the arm. So that you would feel nothing during the time of delivery and all that sort of thing. Now, and if you want to watch the birth of the baby, that's how you can have your baby. However, if you would rather have it in the coma state of hypnosis, which assures you of an absolutely painless delivery, except that you're in the coma, you don't feel anything, but you can't move. The muscles are so relaxed that none of the muscle will work. You know that. So you got to take your choice now. You've had two wonderful states shown to you. Which way would you rather have the baby?
I'd like to watch.
What?
I'd like to watch this.
You'd like to watch the baby. In other words, you like this state better. All you'd have to do to anesthetize her at time of delivery now would be to give her the post-hypnotic suggestion that she will have absolutely no feeling in her body from the time that she has the first contraction. But also, be sure that you get her over the hospital awfully fast. Because since they have no resistance to the contractions, each contraction carries them about 25 times further than they would ordinarily. There's no resistance, there's no tensions there at all. And consequently, the contraction goes as far as nature intended the contraction to go. And you'll find that sometimes maybe 5 or 6 contractions will carry them, well, almost to crowning. I think you found that, isn't that right, Dr. Berkman?
Well, they go very fast. I don't know. I think I was daydreaming then. I didn't hear what you said.
Well, what I'm saying is that because they feel absolutely nothing, they've got this perfect anesthesia, that the contractions carry them so much further. Each contraction carries them about 25 times more than an ordinary contraction would carry them. And we have known cases where they've had about 6 contractions, and they're just practically about ready to crown. Now, you know, the funniest thing happens to people when I take drinks of water. Now you have the state duplicated. Now you get the state duplicated just as I'm duplicating it here. Then you give the suggestion. You'll be able to hear me now. You can hear me, but you will not wake up. You can hear me, but you will not wake up. I'll know that you're hearing me when that forefinger that I touched before begins to rise. I'll know you're hearing me, but you won't wake up. That's right. Now, when you have your first contraction, I want you to telephone your doctor, and he'll tell you what to do. When he gives you a cue word which will be decided upon between you, you will have complete anesthesia over your entire body from the shoulders down, just as you had it in the arms. He will only have to say that cue word over the telephone, giving you instructions as to what to do, and you will have that complete anesthesia all the way through. Now, should you by any chance call at a time when he is not available in his office or at the hospital or wherever you call him, he will give you instructions how you can say another word and have complete anesthesia until you are able to reach him. Do you understand that? In other words, I'll show you what I mean. I am going to give you a cue word, and I want your doctor to remember this. Will you be in a position to give her the cue word? All right. The cue word is apple. When he says apple to you, over the telephone or wherever it is, if he's right with you, you can just say the word apple. And you will have anesthesia all over your body instantly. Now, suppose he is, and you can have your baby without feeling a thing. But suppose he is not available when you call. Then I want you to say the word orange. And you'll have anesthesia until you are in touch with him. But you will be fully awake at all times when you have this anesthesia. But when he says the word apple to you, that means that you can either fall asleep while you're having the contractions, do anything you want, or you can remain fully awake while you're having them, but you will have perfect anesthesia and won't feel any of them, whether the word apple or orange is used, and you'll be wide awake and you'll know to get to the hospital on time and all that sort of thing, won't you? All right. Now, all this is going to happen at the time of the birth of your baby. So now, I'm just going to practice it once. When you open your eyes, I'm going to have your doctor say the word apple to you. And I'm going to see, and you're going to see, how well this anesthesia works completely all over your body. You'll have no anesthesia, however, when you open your eyes. That suggestion I gave you before about the anesthesia will be gone, and you'll find there'll be no anesthesia until he says the word apple, at which time there'll be complete anesthesia all over your body. All right, now open your eyes and notice how good you feel. How do you feel? Pretty good. Doctor, would you like to come up, please? Don't exert much pressure and don't say any word, but just see that all feeling is quite normal there, will you please? But don't close them or anything. Just Just make a little test to let her see that she feels things.
Yeah.
Yeah, that's enough. That's enough. All right. Now, say the word apple to her.
Apple.
Well, watch what he's doing, and go ahead, Doctor, make a test there, and you're going to be amazed at what you see happens. Feel anything at all?
Yeah, I feel it.
That's good all the time. Apple. What I was doing was waiting for it. I was waiting for it to establish.
Yeah.
Now it's close enough.
Right.
Mr. Elm,
Yeah.
may I say a word here?
Yeah.
I think if he would just compound her a couple of times right now,
Yeah.
he'd have just exactly what he wants.
Yeah.
By repeating the word?
Yes, just repeat it a couple of times, that's all.
Yes, like apples. It won't be something out. It's for apples English. Now, let's see. That hurts the back.
All right, now then, Doctor, let's do it. Let's just close your eyes. Now, when I have you open your eyes, I'm going to take one swig of water, and you'll fall fast and sound asleep, just as you did before. All right, open your eyes. Now, when I have you wake up, you're going to find that the suggestions I gave you before have increased tenfold. And you're going to find that when the doctor says the word apple, that you have anesthesia all over your body, from shoulders to toes. You'll have absolutely no feeling. It will be the best anesthesia you ever had in your life. Now, when I stop talking, you'll wake up and you won't remember that I've given you this suggestion. But you will be guided by it. All right. Say the word apple to her now before she wakes up so that she knows that she's going to have it perfectly when you...
Apple.
Now she'll wake up. And you can wake up now.
How do you feel?
Yeah. Now, let's see what happens. You have any feeling in either arm or body or anything? Have any feeling anywhere?
I don't think so.
All right.
Feels
Go
numb?
ahead.
That's just...
In just a moment, when I have you open your eyes, you're going to have complete confidence in the fact that every time the doctor says the word apple, that you will have just as complete anesthesia as you just had a couple of seconds ago. Now, I want this anesthesia to come on fast, so that he'll just have to say the word, and it will be there. Now, all this is going to happen after I have you open your eyes, for I want you to see that anesthesia is as deep when he says that word as it was a while ago, and then it'll always be that deep whenever he says that word, and I think you want it that deep, don't you? So I'll stop talking now, and in about 2 seconds your eyes will open, and you'll be awake. Wait, Doctor, first, I want to ask you just one question. Could you feel that you had feeling all through your body when you opened your eyes?
Pretty much, but I think I still had.
Still had some anesthesia? All right, wait a little while for that anesthesia to be gone. And then say that word again, will you, Doctor?
Apple. Like you have it.
Just anywhere but up in that upper arm. That's fine.
All right, good. All right, now, he's going to be able to work on any part of you, and you'll have no more feeling than you had there, because there's a little fear there about the upper arm. I don't want that fear to be there. I want that fear completely erased. Because not that he's going to test on the upper arm if you don't want to test there. But I want anesthesia throughout the body at the time you have the baby. Completely throughout. So if you work with her a couple of times, doctor, in your office. When do you do?
1st of June.
1st of June. Well, you've got a couple of times to work with her. It'll be wonderful. Okay.
Well, one question I'd like to talk. You use the word you cautioned us against several times, and it's a can't. When you approach them on your semantics here, when you say, you can hear me, but you can't wake up.
Yeah.
In that instance, can it be used?
Oh, yes. Yeah.
Will they take visual and auditory hallucinations in this state?
In the sleep state? Oh, yes, you can give them dreams. Yes, sure you can. And all of those things are dreams. That's all they are. Now, friends, we're going into what we were supposed to do 2 weeks ago. When a subject under hypnosis is told by the operator that no one but the operator or those specifically appointed by the operator will ever be able to put the subject into the hypnotic state, the subject is said to be sealed off and the operator is said to be using the seal. Although that's the form that the seal takes usually, there are many variations, some of which are quite vicious. Now, while other courses still continue to teach doctors how to apply the seal, we go a little bit further. We teach you how to break the seals that anybody else puts on. We don't like the seal, we have no use for the seal, and we hope that our doctors won't use it. In fact, this is the one part of the course which, if I had my say about, I would completely eliminate. And the reason I would eliminate it is that I just have no use for the seal. I think the people who use it are short-sighted. Sometimes they're quite vicious people, and I just don't like the seal used. I see no earthly good, and I hope to prove to you today that it is no good. But the fact that it is still being used, oh yes, you can't get away from the fact that they still use it. Let me give you an idea of how the seal works. Came into a class in Columbus, Ohio, and one of the doctors at about the 3rd session comes to me and he says, you know, Mr. Elman, I've been doing some extensive work on a dental patient using hypnosis, and she's got to be away from the office for a couple of weeks, and she's going up to New Jersey. Now, I wanted to go 2 weeks without seeing a dentist. Is there someone up there that uses hypnosis that I could send her to? And I said, sure. Send her to Aaron Moss. Dr. Moss has written a book on hypnosis, and while the book isn't much good, at least he does know how to use hypnosis. So send her to him. Now, it's a few weeks later, and he comes to class, and he says, Mr. Elman, he says, the most terrible thing has happened. He says, you know that patient I was telling you about that I sent to New Jersey? She's come back from New Jersey, and I haven't been able to hypnotize her at all, and I have extensive work to do on her mouth. Well, I knew what had been done, and I told him to bring her to class. Whereupon we discovered that Aaron Moss had been kind enough to seal her off when she was in Bernardsville, New Jersey, with the effect that it sealed her off from her own dentist. Now, these people who use the seal will always hem and haw around and say, well, we use it for a good purpose. We're trying to protect the patient from what? You ask. He could what? Go ahead, tell me, what could he do? Well, and then they hem and haw and they don't know the answer. But they say, well, we put 1,000 protections around the seal. We say to the patient that only a qualified doctor can do it. All right, I'm not a qualified doctor. I'm not even a doctor. I'm not any kind of a doctor. But I challenge anybody in the world to put on a seal that I can't break. And if a layman can break a seal, of what good is it to a doctor? And what about this idea of qualified doctor, which is another thing that they put into their statements? I have no doubt, because we have a tape recording of what occurred, that Aaron Moss sealed her off using the words, only a qualified doctor. But don't you people know that to many minds, a dentist is not a doctor. Only an MD is a doctor. And when you say only a qualified doctor, it immediately restricts you from all dentists. So right off the reel, you've got a horrible thing to combat. It's in dentistry where the seal is used the most. And it's these people who have been listening to the wrong things and reading the wrong books and so on that are using the seal the most. For example, hypnodontists in the New York area and in Connecticut, Chicago, every place where they form groups, they use the seal and teach the seal. And it's a very nasty thing to do. I don't think there's any reason in the world why a doctor should ever use the seal, and I hope to prove to you the uselessness of the seal. Now, let me work with another person now. Take a good long deep breath, close your eyes. Now, when we do it again, I want you to relax 10 times more than you've already relaxed. And you'll find that that relaxation goes all through your body. Now open your eyes, now close them, and now really relax. Now, when we do it the third time, you'll have complete relaxation throughout your body. Now open your eyes, now close your eyes, and now completely relax. And just because you look so relaxed from here, I'm not even going to make that test for physical relaxation of lifting your hand. But I just want you to start counting backwards from 100. Make the numbers disappear. Now they'll be gone. All gone? Oh, that's right. Now that's a pretty pleasant state. And I know that it's a very important thing for you to have. But for purposes of experimentation this afternoon, just so that I can show my doctors what the seal is like, I would like to make this suggestion to you, and I want you to take it. That no one in the world, other than myself, will be able to hypnotize you this afternoon. And you notice I'm putting a time limit on it, Doctor, because I want to make sure that you never lose this state permanently. Do you know what I mean? But for the time being, should anybody try to hypnotize you, you're going to find that you can't even get eye closure. You're going to find that the hypnosis is just gone. But I can put you into the state very easily. Just tell you to close your eyes and you'll immediately make the numbers disappear for me, just as you did just now. And so when you open your eyes, notice how good you feel, but nobody will be able to hypnotize you other than myself, and I'll be able to do it easily. All right, open your eyes and notice how good you feel. How do you feel?
Fine.
Pretty relaxed? All right. Now, and your doctor is who? Over here. Is that right? Would you see if he's sealed off, doctor?
I just close your eyes and relax like you did before. Take a real deep breath. Take a deep breath. Let surface tension off completely. Just let the eyelids relax completely. And relaxation will clear to your very toes. Take another deep breath. Let those eyelids relax. Let them relax. Let those eyelids relax so they don't even want to work at all. Just test them. You think you got them, but they won't work. Just let them relax now.
You see the difference? Can you see the difference?
Let's make a tight fist here. Just make a real tight fist. Just make it real rigid. Real rigid. And just let yourself relax as your arm gets more rigid. Relax. Now just let your arm relax gradually and fall on your lap. Just let you relax clear all over your body. Just relax now.
See what I mean, Doctor?
He's coming back.
Sure. Because you see, that's the effect of a seal, and isn't that a dirty trick to play on a person? Now, I mean, here seal him off from his own doctor. Now, can you imagine how he would feel? And can you imagine how I feel when I hear of this being done, and that they're teaching it in the courses yet? We laughed this out of existence for years in the East, to the place where not a course in the East taught the seal. We even got the hypnodontist to relinquish teaching it for a while. But let me start on a Western tour, and they're back teaching it again. Now that man isn't there to hinder us, and so they start teaching the seal again. I think this is just about as unethical as you can get, and I don't like it. And I don't think that it's necessary. I can't see one solitary thing that you, for example, would be protecting him from if you took away his power to help himself. And it's been very useful to him, hasn't it? Sure. Now, can you imagine some doctor does that to you, and now you start to work with him, and he's no longer finding it valuable, and all your work has gone for naught? It's a pretty nasty spot to be in, isn't it? Now, let me show you how easily he gets the state. Now, close your eyes, and you'll be able to make those numbers disappear instantly. Now, numbers all gone? And he's got the state already. Now, I'm going to remove all those suggestions that I gave to you. I'm going to remove them completely so that you have no seals whatsoever. You can get this state anytime you want to. But I would like to know if I may do something, if you don't mind, because you do take the state so beautifully. Would it be all right if I had one of the other doctors seal you off and then let you see how the seal can be broken? Is that all right with you? I assure you that we will attach no permanent seal to you, because I know you'd probably reject it if we did. But if somebody else wants to work with you and attach the seal, let them. Is that all right with you? Okay. All right, when I have you open your eyes, notice how good you feel. Open your eyes. Now, doctor, would you seal him off, but good? Well, yes, you can, doctor. Just remember what I did. I mean, I just made it impossible for anybody else in the world to hypnotize him. You do the very same thing.
All right. Take a deep breath and relax. Your eyelids relax. You get this to a hurry. Let those numbers disappear already. You can make them disappear in a hurry. All right. Can you see more numbers at all? They're all gone. All right. At any time this afternoon, nobody will be able to put you in this state except myself. I'll be the only one who will be able to put you in this state. No other doctor, no other individual at all will be able to put you in the same state.
Get his consent. Ask if that's all right with him.
Is it all right with you if you're in this state all afternoon? It's okay with you if nobody else can hypnotize you this afternoon whatsoever. Nobody can put you in the same state of relaxation whatsoever. Is it all right with you?
Yes.
All right.
Tell him you won't even be able to get eye closed. I mean, make it strong.
All right. You won't even be able to keep your eyes relaxed. You won't be able to relax at all. Anybody else's suggestion whatsoever. You will not be able to get the numbers. They will not disappear for him or anything. No stage of relaxation will you really reach. Is it all right with you?
Yes.
All right. Just a minute. I'll have you open your eyes and you'll feel fine. Get ready. All right. When I quit talking, you'll open your eyes in a few seconds.
A nice state. Now, that was a pretty good seal, and you all heard it. Now let's see if he took the seal. Would you just close your eyes, see if you get an eye closer, please? See what I mean? He's sealed off. You can see that. All right. Now, you don't have to try anymore. You don't have to try anymore. Now, I want to ask you something. Now, watch this closely, folks, because one of the reasons that the seal is impractical, let's put it that way. To the man who knows his way around in the seal presents no problems whatsoever.